Hello and welcome into the clinical chemistry diagnosis. Today I will talking about the metabolic changes in geriatrics. This lecture is presented by Dr. Zuhair. In this lecture I will talking about the definition of geriatrics and gerontology, current theories of aging, disease and disorders commonly associated with aging. The top 10 leading to cause of death by men over age 65 and elder. Firstly, introduction. Aging means to grow elder. Geriatrics is a branch of health care concerned with the care of the aged, including psychological, pathological, and physiological. So, this also known as sociological problem. Gerontology is the study of the aging process. Several psychological changes occur as people age. These changes are gradual. Deterioration result of the time-dependent irreversible changes. These changes will be reflected in clinical laboratory test result. Life expectancy is increasing for person born in 19 to 7 years to 77 years for person born in 21. This gain 2001. This gain is due to improved sanitation, better medical care, and increased use of preventive health service. The demand of the healthcare system by geriatric patients is different from that of rest of population. Healthcare will need to shift its emphasis to meet the need of chronically ill. As the population gains or ages increase in chronic disease such as cancer, arthritis, hypertension, and diabetes are expected. This means more physician office visit, hospital stay, and laboratory tests. In this by meaning that when the subject or person go on in life and get elderly by time, is also need some special laboratory test and need to visit the physician office regular because there are many disease and risk factors concerned with the age. So the clinical laboratory professionals must treat the patient with dignity and respect. They must be aware of special consideration regarding this collection of blood sample, development of reference interval, effect of medication on chemistry result. They must understand the effect of aging on laboratory value. So, in this slide, what is the current theories of aging? That by mere random genetic damage or glycation proteins. So, what is the current theory of aging? One, random genetic damage, and this also due to a mutation by mean the causes of gene mutation related to radiation damage or ultraviolet X-ray and maybe cause chromosome or DNA damage, and errors in chromosomal translocation or transcription. Number two, glycation of protein interfere with the both cell structure and function. 3. Developmental theories, immune and neuroendocrine system, immune system decline with age, thymus atrophy, reduction of B and T cell population, decreased response to neoantigens, misfolding of proteins, which may lead to amyloidosis. Genetically programmed theory, that by meaning the defect in apoptosis. And apoptosis is the programming of cell death. 5. Free radicals such as OH, oxygen, and NO. This also causes damage to the cell. Disease and disorder commonly associated with aging, such as atherosclerosis, which can lead to myocardial infarction, renal disease, and stroke. Cancers, diabetes mellitus, hyperparathyroidism, hyperthyroidism, hypothyroidism, monoclonal gammopathies such as multiple myeloma and osteoporosis. The top 10 leading to cause of death according to the researchers in age over 65 and elder is the heart disease number 1, cancer, stroke, chronic lower respiratory disease, accidental death due to an unintentional injury, diabetes, Alzheimer's disease, influenza or pneumonia, nephritis, nephrotic syndrome, and nephrosis. And lastly, septicemia. These are the top 10 leading to cause of death in age over 65. Changes in selected clinical chemistry analysis with the age. There are some analyses or some of tests increase with the aging, such as gamma glutamate transferase, ALB, alkaline phosphatase, alpha 1 antitrypsin amylase, AST, blood urea nitrogen, PON, CK, creatine kinase, gamma globulin, fasting glucose, and HDL cholesterol. And either increase in inorganic phosphate, lactate dehydrogenase, partial carbon dioxide, potassium, total cholesterol, triglyceride, TSH, and uric acid. And there is some analytes decrease with the aging, such as albumin, aldosterone, bilirubin, creatine kinase, dihydroepiandrosterone, growth hormone, partial oxygen, T3, total protein, transference. Some analyte unchanging, such as chloride, cortisol, free T4, haptoglobin, insulin, fasting, pH or slight decrease, sodium, T4 or slight decrease, thyroid, binding globulin, TBG. So, what is the endocrine function changes with the aging? Changes in the production of hormones by sex organ, thyroid, pituitary, and adrenal glands. The most notable changes related to the gonadal and thyroid hormones. That by mean this is the two major glands affected by the age, which include gonadal and thyroid hormone. A decrease in gonadal production of estrogen in women, which can lead to menopause in aging women, and testosterone decrease in men, which can lead to andropause in men. The adrenal production of dihydroepiandrosterone DHEA and dihydroepiandrosterone sulfate is lead to adrenopause in men. So this is the reference can help you for further knowledge about the aging and the chemical or biochemistry or related to analyze that change in the elderly. Thank you very much.